When you train to become a doctor, there is no bigger jump than the one from preclinical medicine to examining your first patient. To begin with, it's all science. In this program, we follow the experience of two medical students as they begin their clinical studies.
And as you can see, we have a very similar sort of picture to what we have in the textbook here. And you'll see at this magnification, these again are human lymphocytes.
Margaret Bell and John Hawkins are shortly starting their first surgical firm. We are going to take a look through the students' eyes at how clinical medicine gets taught on the wards, what their patients have to go through, and what is expected of the students themselves.
So, what books are you taking with you?
I'm not sure, really. I thought I'd just wait and see what we needed.
Yeah, best thing. Hey, it's Alex. How was the exam this morning?
Hi.
Hi. How was the path paper this morning?
Oh, it wasn't too bad, actually. It was all right. Just got the one tomorrow, and then that's it. Hey, listen, where are you starting your clinical?
We're both going to Sutton.
Where's that?
Oh, it's easy to find. Just down near St Heliers.
How on earth are you going to get there?
Just got a new car. See ya.
What's this car like, then?
Hi. Sorry I'm late.
That's okay.
Where are we today?
Foster Ward.
Where's that?
First floor, I think.
I've got a meeting at 12, so I'm in a bit of a hurry.
Yes, this is the acute abdomen that I admitted during the night, sir.
Oh, yes, you were telling me about her.
I couldn't feel the gallbladder, but she's guarding.
Temperature's certainly up, isn't it?
Yes, she's pyrexial just over 100.
Well, she certainly is very tender, isn't she? Have a feel of that, because that's quite interesting. What other evidence have you got?
The white cell count is raised.
What's that up to?
13,000.
Well, that's pretty suggestive of infection, isn't it?
Yes.
Yes. Is that mainly polymorphs?
95% polymorphs.
Yeah, well, that's certainly so. What about her liver function tests?
The bilirubin's within normal limits, but the enzymes are raised, the SGOT particularly.
Yes. Well, they're misleading, aren't they, very
At this
often, but
stage.
it can be quite a bit helpful. Have you managed to get an ultrasound done?
Yes, we had that done first thing this morning. We've got the films up here, but they've not been reported on yet.
Well done, that's very good. Don't worry about it, we'll put it all right for you this afternoon. Bye-bye.
Are they going to operate?
I think so.
Well, what are they going to do then?
Well, I don't know, actually. I wanted to ask them, but they were in such a hurry I didn't want to make a fuss.
John and Margaret have just had their first lesson in communication failure. Let's take a look now at what should have happened but didn't. And while you are watching, look out for as many points of difference as you can.
Don't forget I've got the meeting at 12, will you?
Yes, this is Mrs. Peters.
Hello, Mrs. Peters. I'm the consultant looking after you. You know the senior registrar, of course, but I don't think you know our two students who are with us today. How's your tummy?
Still very sore.
Still very sore. Tell us about her.
Yes, well, Mrs. Peters came in during the night. She'd developed severe abdominal pain yesterday afternoon and vomited. And when I examined her, when she came in, there was considerable tenderness in the right hypochondrium, and I could feel a distinct gallbladder mass there.
Good, very good. Can we look at your tummy, please?
Yes.
Can you just put your hands by your side for a moment so your tummy's nice and loose? Very important if you're going to examine someone's tummy is that they're nice and relaxed, otherwise you won't see anything at all. Just take a deep breath in for us, can you? And out again. Now what you're looking for is to see if there's a gallbladder appearing under the muscle. And do that again, and you'll see it moving out there. Does it hurt you to breathe like that? Just going to have a little feel. You always want to start feeling away from the area which you know is affected, the normal area, and use the flat of your hand, not your fingertips like this, because that hurts. And you roll your hand in like this, and gradually come round to the area that you know that's bad. And as she does that, okay, breathe normally, I can feel the gallbladder mass, great inflamed mass, come down onto my hands. Would you mind if the students felt this? They'll be very gentle. Have a feel now. And just the same way as I did. With the flat of your hand and start away from the affected area. Gently, watch the patient's face, because otherwise you know if you're hurting her or not. That's good. And come on round. The rest of the tummy is nice and soft. Okay, and let your, again, a bit further over, and let your hand just relax. Take a deep breath in. If you can just relax a tick, because it's very important. Let her feel this. Okay, another deep breath in. Very good. And hand away. And did you feel the gallbladder come down?
Yes.
It's quite easy when you do it like that, isn't it? Can you bear another student feeling you? Very good, thank you. Have a feel as well. Just the same way. That's right. Gently, watching the patient. It's getting sore, so you know you're getting near the air. Now let your hand relax there. Take a deep breath in. Feel it, and hand away. Okay? Thank you very much. I won't distress you any more with that. Have we got any other evidence to go on?
Yes, well, Mrs. Peters has a
Introducing yourself courteously to your patient, helping your patient relax, and being aware of the discomfort that your examination may cause will all help in eliciting the physical signs properly and with minimum distress.
But I thought that lady we saw with the acute abdomen, who was admitted in the night, was rather more anxious than we would have expected. And I wonder if either of you know why.
Yes, I think something that will definitely increase her anxieties was the fact that her mother died soon after a major operation.
Very good. How on earth did you know that?
Well, I had a quick peek at our notes before we looked
Very
at
good.
it.
Well, that's good. I mean, you want to get information wherever you can, so reading the notes is a good source of information. Yes, do you know what she died of, though?
Cancer of the stomach.
Yeah, that's right. So the lady we saw then is reason to be doubly frightened.
Yeah.
First of all, she's afraid she might have cancer, and
Yes.
secondly, she's afraid she may die from the operation, which is fair enough, isn't it?
This is a scene we're all very familiar with, but if waiting for an hour and a half isn't bad enough, try keeping a baby happy at the same time.
Mrs. Hunter.
Come in. Mrs. Fox.
No, I'm Mrs. Hunter.
Well, Mrs. Hunter, it must be 6 months since you came to see Dr. Jenkins here first.
Yes.
And what's happened since then?
Well, I've had one or two more attacks.
Yeah, tell me about them.
Well, the last one was I had to go to see my GP. That would give me
That's is that Dr. Khan?
That's right. Yes.
Yeah.
Yes.
Okay.
Well, that would be. Let me think now. My mum came on Wednesday, so I suppose it would have been the day before. Yes, that's right.
Which week are you talking about, Mrs. Hunter? This week or last week?
Oh no, not this week.
I mean, 10 days ago.
Well, yes, it would be about that. Yes. Yes. He gave me the tablets. He gave me some more tablets.
What tablets did he give you?
Well, I don't know what they're called. They were red and black.
Sounds like ampicillin. And that got rid of your symptoms for you?
That's right, yes.
Yes, good.
But I told you all that a
Yes,
fortnight
and
ago.
Incidentally, she's had an IVP done as well, just to make sure there's no abnormality further up the renal tract. Your test was normal, wasn't it, when you had the x-rays and
Yes.
the injection? And since then, everything's been fine, has it?
No, I told you this a fortnight ago. It all
Oh,
came back.
yes, we took another urine sample because your symptoms returned, didn't
Yes,
they? Now,
yes.
we'll have the answer to
I've
that
still
here.
got it.
And, well, that's interesting. Quite normal. No growth, no organisms.
Well, then what's causing it?
Well, you haven't got a urinary infection now, Mrs. Hunter.
Well, what's causing it then? It must
Well,
be something.
You certainly haven't got a urinary infection. I noticed, by the way, that you've been a number of times to see Dr. Croft, our psychiatrist. You've been depressed, I gather.
Well, that was 3 years
And
ago.
it's very important to make sure there's no functional overlay, you know, emotional contribution.
But how can it be emotional, Doctor? It just comes away. It's really
Well,
embarrassing.
all I
It
can
stains
say
my
to you,
underclothes
Mrs.
and
Hunter,
it
is that
smells.
your urine does not have an infection. So, in my
It can't
judgment,
possibly be in my
the
imagination.
next
It can't
step
be
is
in my
to see
mind.
Dr. Croft.
But
And
I don't see
come
how
back
he
to
could
me
help with
and,
something like this.
We can always review it in a short while. So if you don't mind, we'll refer you to Dr. Croft and I'll let Dr. Khan, your GP, know what we're going to do and then we'll see you again. All right? Good. Bye-bye, Mrs. Hunter.
Thank you, Doctor.
Nurse.
When you're under pressure, that's what can happen, all too easily. Now let's see it again.
Mrs. Hunter.
Oh, Mrs. Hunter, do come in. Please sit down. First, let me introduce our two new medical students, Mr. Hawkins and Miss Bell. I hope you don't mind if they sit in with us.
Hello.
And secondly, let me say I'm sorry for keeping you waiting. You must have been out there for more than an hour. It's just been one of those mornings.
Well, I know. I know how busy you are.
Have you got the baby with you?
Yes, she's asleep.
Oh, thank goodness for that. Right. Now, since you came a fortnight ago, we've had the urine result back, and surprisingly, it's absolutely normal. I say surprising because I'd expected us to find another infection.
So what's causing it then?
Well, I'm not sure, but I think we need to go back and think again about just what has been going on.
Yes.
What did you notice wrong?
Well, it was like, I thought it was going to be like the last time. I
Mhm.
couldn't seem to hold my water. And then it didn't sort of progress.
Does that mean that you were going to the lavatory more often?
Well, it's more it comes away.
Between times?
Yes.
Actually leaking?
Yes.
What situations does that happen in?
Well, it could be any.
You're coughing or sneezing?
Yes. Yes, if I cough and making the bed.
Yes. Any blood in your urine at all?
No, not this time.
No burning at all?
Not this time, no.
Yes. See, this isn't so suggestive of a urinary infection. It sounds more as if there's an escape of urine, and that may have a mechanical cause. Well, you see, I'm just wondering, Mrs. Hunter, if it could relate at all to having the baby. Can we think back to when you'd had the baby and whether you had any symptoms like this at all, even fleetingly?
Yes.
Quite soon
I
after?
think I did, yes. Only I didn't think anything of it. Well, things happen when you have babies.
Yes. How might that relate, do you think?
Well, she might have had a weakening of some muscles through the labour.
Exactly. I think that's very likely what's happened. And perhaps we've been on the wrong track. That would mean that this is something called stress incontinence.
What do you mean by stress?
Well, I mean a physical kind of stress, that the muscles aren't supporting the bladder as well as they should do. They're a bit stretched, and so you're getting a bit of a leak of urine at moments when you least want it. Now, if that's so, we should get you another appointment with Mr. Richardson, and he would advise you about that, either exercises or a small operation, which will just tighten
This
up those
interview
muscles.
took no longer than the first one,
And I'm sure it can be
and
treated.
it leads to the right diagnosis. Some examinations are by their very nature unpleasant, and so need to be done with extra care.
Let's have another word with Mr. Wilson, shall we? Hello, Mr. Wilson.
Good morning.
Can we have another look at you, please?
Yes.
What I want to do is to examine you inside your bottom end to try and sort out this bleeding problem of yours. And what I'm going to do is to feel inside your bottom with my finger and see what it's all about. Would that be okay?
Right.
Can you draw the curtains round for us, please? If you could just sit forward for a moment for me. Just take that away for you. Get your pillows up, and then if you can slide down the bed and roll onto your side for us. That's very good. Now, it's gone a bit too far. Now, hold on just a tick. First, the most important thing when doing a rectal examination is to have a patient who's relaxed and not too tense about it, and then you've got to have him in the right position. Because what you've got to remember is that not only is there a block about having a rectal examination done, but of course there's a block about doing them. People don't like doing them for some reason. So it's very important that if you're going to do it, you do it properly. Okay? So which means that he must be nice and relaxed, and we must be able to see what we're doing. And the first thing, we want him on his side, and then we want his bottom right near the edge of the bed. Would you mind coming back onto your side for us? That's very good. And then wriggle your bottom right towards the edge of the bed, towards me, so you're almost going to fall off. Bit more. Very good. Okay? And then bend up your knees into a little ball, and then we can arrange the bedclothes so that he doesn't feel too exposed and also keeps him warm. And then we've got a good view of his bottom, and he's nice and relaxed. Now, Mr. Wilson, what I'm going to do is to feel inside your bottom with my finger. I won't hurt you at all, but it is uncomfortable. If it gets too uncomfortable, give a shout and I'll stop at once.
Right.
Okay? But try and keep as relaxed as you can.
Right.
Very good. Then you get a glove. Put it on, make sure it's on properly so you've got good sensation. And then we need a little bit of lubricant, obviously. Like that. And then we just get him ready. Just going to pull your trousers down a bit now. There we are. Now, you must warn him that you're going to do it, because you must remember that dilating a sphincter is a very stimulating and can be a very painful experience. So you must say to him, I'm now just going to slip my finger gently inside, all right? And the great thing is to take your time. Don't hurry, okay? So you quietly slip the finger in, and in we go. And then, when it's in, full length of your finger, examine the wall of the rectum in quadrants. Sweep across this way, sweep up posteriorly, sweep across on the right lateral side, and then bend down if necessary to get the anterior surface. Okay? Now that's the lower part of the rectum. With practice, you can probably reach almost to 15 centimetres, and that's going to mean a bit of a push. So again, we warn him we're going to do it. I'm going to push a bit hard now. Might be a bit uncomfortable. And you push a bit harder, turn the hand, feel again, and then slowly take the finger out. You okay? Would you mind if one of the students felt now?
No.
Should be very gentle. You're very good. Thank you very much. Right, now would you like to get a glove on? That's good. And now you want to put your hand in the glove rather than behind it. It works better. That's good. Now, get it on properly, otherwise you can't feel a thing. Otherwise, and also your finger will break through it. Okay, that's the important finger after all. All right, bit of jelly on the end. Very good. Right, take up your position now. All right? Okay, now put a hand on his hip so he knows it's you. Okay, because he can't see what's going on. Warn him you're going to put your finger in.
I'm going to start now.
Okay, slide it in. Very good. Now then, feel round, bottom half, up round the top half. Now then, warn him you're going to press a little bit hard.
I'm just going to go in a little further now.
Okay, press hard. Now can you feel anything?
Well, to be honest, I can't really feel very much.
Well, that's natural. Normally the first several times you can't feel anything at all. It takes a lot of practice. So don't worry about that. The important thing today is to know what it's like to have a finger in there. Feel the sphincter gripping your finger. Okay, Now slide your finger out gently. Very good. And then you get a Kleenex. And you gently wipe its bottom. Okay, Mr. Wilson, we're all finished. Very good. If you like to just roll over and sit up, we'll just have a talk about that. Here we are. All right?
Thank you.
Very good. Now, what I found up there was a little growth up in the back passage.
Yes.
And what I would like to do tomorrow is to give you a general anaesthetic and have a look at it with a telescope and take a little piece away so we can sort out exactly what it is.
I see. And do you think this growth is cancerous?
Well, it could be. It's one of the things we always think about, and that's why we will always take a piece away to test it for you. Because if it is, we'll need to put it right for you.
Yes.
I think that the sooner we get on with this, the better, really, and if I can do it tomorrow morning. That would be the best time.
All right.
Okay, very good. There'll be a bit of preparation beforehand, but we'll talk to you about that later on.
All
okay?
right.
So we'll plan for tomorrow morning.
Thank you.
Very good. Bye-bye.
Thank you.
Bye-bye.
It's not only you finds it embarrassing, the profession generally does, and there's a great resistance to doing rectal examinations. So that's why it's so important to learn how to do it properly and then practice it frequently. Almost every patient you see should have one, so you should get the practice. I was sorry you weren't able to feel as well, but I think that there's a limit really to what you can do to someone, and if we had all queued up there doing rectal examinations, it would have been quite wrong, because it's a bad enough invasion of a chap's privacy anyway, isn't it? As we were saying the other day, he's probably a bit frightened, and we can't all do rectal examinations on him. We mustn't forget that, you know, we take quite a lot on trust, really. You know, they expect that we're going to behave in a reasonable sort of way, so that we must respect that as well. And you must never forget that actually a patient on the other end.
Helping our patients to keep their dignity and self-respect is particularly important when our aim is no longer cure, but instead is to relieve pain and suffering.
You can see as the dressings come off, starting up here on the normal skin, there's some little bobbles, okay, which are little hard lumps. And then we've got this ulcerated area here, which really extends right the way across. Okay. Can we just look in your armpit a little bit? And you see it extends up into there. And in fact, she's had surgery there, which has removed the muscle there, and obviously the lymph nodes, and hence the lymphedema.
Well, of course, I've become very attached to this hospital. So, to me, it's almost second home. They've always looked after me so marvellously here that I feel if you tell me that I have to come back, it's never a horror to me at all.
What do you feel about your going out again now?
Well, now that is a bit different, because I feel under present circumstances, as I am, I wouldn't be able to look after myself.
No. Do you think that you'll ever get out?
I don't know. I haven't come to a conclusion about that yet. Sometimes I have my doubts. Sometimes I think to myself, well, come on, you've got to get out. But it's a little bit difficult, or at least let me say this, I am finding it difficult.
But to come to terms with that sort of decision, as it were.
Yes.
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 What, if you were to go home, what would you want to go home to do? What are the things you're missing and that you're anxious to do at home?
Look after my garden a bit. I have regretfully sold my car, but I would never be able to drive that again satisfactorily. Or happily to my own way of living, because I felt I wouldn't be able to control the car. So that,
well, let us know if you're going to drive by, and we'll all go home that day, I think. Thank you very much.
I'll send you all a telegram.
Yes, do. Thank you for talking to us.
Thank
very
you.
kind.
Pub's open half an hour ago.
Sometimes it's a good thing we can see the funny side of life too.
sleep. And you can stop laughing as well. I've had enough today. Absolutely enough.